Hey everyone, thank you for checking out my video and my channel, Travel with a Twist. So today is my first full-length video and we are going to talk about polycystic kidney disease. So each video, I'm gonna have 3 different segments. The bulk of the video is going to be about the topic that we're talking about for that day. The second part of the video is going to be about how a kidney transplant is going to impact my life for the better. And then the third part is going to be a travel tip of the day for kidney disease patients to help travel easier, or really anybody that wants to have some good tips on how to have better travel experiences. So today we're talking about polycystic kidney disease. I'm gonna go over kind of an overview of what it is, how you get it, how I got it, and some common symptoms. So basically, polycystic kidney disease is just like it sounds. Polycystic means many cysts. So essentially, polycystic kidneys are kidneys that have many cysts that have developed on them. This is a genetically inherited disease, and it's actually super common, more common than many people realize. There are over 600,000 Americans that are affected by this disease and 12.4 million people worldwide that have it. So it's actually one of the world's most common genetically life-threatening diseases. It's more common than Down syndrome, cystic fibrosis, muscular dystrophy, sickle cell anemia, and hemophilia combined. So many people have heard of all of those other ones and they haven't heard of this. So that is why I want to start these videos, to spread awareness about something that's actually really common that many people don't know about. So polycystic kidney disease, there's 2 types. There's autosomal dominant and there's autosomal recessive polycystic kidney disease. Essentially, the difference is based on how the disease is inherited. So I will talk about that in a future video to go over a little more in-depth genetics for all of you science nerds like me out there that find this kind of stuff fascinating. So stay tuned for that. But in the meantime, like I said, there's 2 types. I have autosomal dominant, and so we're gonna focus on that one for now. So I inherited this disease from my dad. He inherited it from my grandma. My grandma inherited it, I think, from her mom, and so on and so on and so on. I have a very strong family history of this disease. And so it's been prevalent in my family, gosh, ever since I know of. And my sister also has it, and my brother does not. So each family can have very different effects from this disease. Like I said, it's inherited, and so as we'll talk about in a future video, how it's inherited determines how many people will get it. So each child has a 50-50 chance of inheriting it. So some families can have every child have it, some can have no child have it. My family has 2 of us, my sister and I, and my brother does not. So basically, polycystic kidney disease is, like I said, many cysts grow on my kidneys. I particularly was diagnosed when I was 4 years old. I guess I was told I had like some kind of abdominal pain or something like that, and they took me in for an ultrasound, and I had cysts visibly on my kidneys. My sister was not diagnosed until she was in her mid-20s. And my dad, I think, was diagnosed in his 20s. So it's one of those things where the biggest point I want to get across about this disease is that it's very individualistic, essentially meaning that everybody is affected differently by it, even in the same family. So for example, my grandma had it, and she was not really impacted from it until later in life. I think she was like, gosh, 60 something when she had a transplant. Her kidneys stayed normal size. And my dad had a transplant when he was 40. His kidneys got very large. I think he said they were like 12 pounds each. And I have large kidneys. My sister has large kidneys. I'm 35. I'm getting close. Obviously, I'm listed for a transplant right now. And so I'm even younger than my dad. So there's kind of a whole spectrum of how this affects people. I've met people that are super old and don't have any issues and hopefully won't need a transplant. I know people that are younger than me that have had a lot of issues and have already had a transplant. So it's kind of, there's no like good way of really telling how it's going to affect people. So that's one of the main takeaways I want you all to know. But as far as the disease itself, like I said, it causes cysts to grow in the kidneys. And so what happens is the cysts grow and they multiply and they get bigger and bigger and bigger. The cysts can be filled with fluids, they can be filled with blood, they can be filled with like just gross stuff. It's not a very like good looking disease. Thank goodness you can't see it on the outside. But so yeah, so the kidneys get these big cysts, and as the cysts continue to grow, they essentially engulf the kidneys. They take over the normal healthy kidney tissue, and you have all these cysts kind of engulfing this normal tissue, and then there's no normal tissue left. It's just all diseased tissue. And that's how people like me get down to needing a kidney transplant. They just don't have any more healthy kidney function left because all of it's taken over by this disease. And yeah, so basically the cysts can cause a lot of problems or no problems at all. Like I said, everything's a little different for everybody. In my case in particular, I've had issues with cysts. My dad had issues with cysts. My grandma didn't. So like I said, everybody is a little different. The cysts can cause pain. So now we'll kind of talk about a little bit of the symptoms that are involved. The cysts can cause pain. The kidneys themselves can cause pain. So if your kidneys get really big, they can be very uncomfortable. So your kidneys are typically the size of your fist. I think mine are probably like a couple fists big each now. They're typically in the back of your back. And as they get larger, they kind of squish in there and squish up organs and make more room for all this stuff. And essentially, like me, I can feel my kidneys from my abdomen. So I'm not a very big person, and so that kind of takes up a lot of room in there. So one of my main symptoms I have is feeling full. All these kidneys and cysts are in there. They take up a lot of room, and so I get full very easily because I don't have a lot of extra room for my organs to move around, for my stomach to expand while eating. What else? Cysts can rupture. So I've had a cyst rupture before. I've had a couple episodes where if they rupture, that essentially leaks out the fluid that's in the cyst. Sorry, again, this is like really gross. But so it'll essentially make you urinate blood if you ruptured a cyst. And so I've had experiences with that where I had my worst time was I went for an entire month, and every time I went to the bathroom, I was essentially bleeding. So that can cause issues. We'll talk more about that in a future video as well. Some other common symptoms, obviously pain as well, from cyst rupturing or just from having kidneys just being big in general. A lot of people are initially diagnosed if they have high blood pressure or if they get a lot of urinary tract infections. That's kind of how they start having these other symptoms, and then they find out, oh yeah, it's because of polycystic kidney disease. Your heart's working extra hard to get your kidneys to function, so you're getting high blood pressure, or you're having cyst issues and you're getting bacteria and stuff where it shouldn't be in your urinary tract, and that's how you get the UTIs. So there's various symptoms that go along with this disease. We'll again talk about that in further episodes. I think actually the next episode we'll get a little more in depth with the specific symptoms. I also have a video picture, I guess, that I'll include in the next video showing you my kidneys. It's pretty cool. I just had a CT scan done for my transplant workup, so I was able to see my kidneys inside my body and see kind of like how big they are, how the cysts look, and so that's pretty crazy. So I'll have to check that out next video. But yeah, so basically that's a little overview about my disease. Kind of talked about a little bit about facts about it, how many people are affected by it, my family history a little bit, how I was diagnosed, and some common symptoms. And just again, like the real important thing I want to stress is that this is a very individualistic disease. It affects everybody so differently, and so this is my experience with this. Obviously, I don't have, medical advice for everybody that is affected by this. The PKD Foundation, which is our main foundation that raises money for research and all of that, has a lot of great information about polycystic kidney disease, what it is, kind of all the stuff we talked about today. So you can check out their website. I put it in the comments or in the description below if you're interested. It's pkdcure.org. And so you can check that out. If you have any questions or comments so far, you can leave that, and I can always answer those in the next video. And so that's our first part of the video. So the second part I want to talk about is how a transplant is going to improve my life. So my big topic today about that is my energy levels. I'm really looking forward to having more energy. Polycystic kidney disease in general, is your body not functioning properly. And so it makes your body work harder, makes you use a lot of energy. And I don't know if you can see my eyes, but I'm pretty wiped out. So one thing that I'm really looking forward to after having a transplant is that I will get some energy back. I'm looking forward to being able to be more active and not getting as tired so easily. Right now, I'm taking naps whenever I can. I sleep, 10, 11 hours a night. It's just a very draining, just very tired. I'm just very tired. And that is a main symptom for me, which I'll also talk about in another video. But yeah, so a transplant will obviously kind of reset, and I know it'll be a work in progress. It's gonna get a little worse before it gets better. But yeah, I'm excited to be able to have more energy again and be able to just kind of like live a full day without feeling like I want to go take a nap, or feeling like I can like stand up and do things without feeling exhausted. Like I feel like right now my favorite position is to be laying horizontal in a bed because it's the least amount of energy I have to use, and I really look forward to it all day. So I'm looking forward to not having to be like that and be able to just have more energy to live life. So I'm getting excited for that part. Our final topic of the day is going to be our travel tip of the day. So my travel tip for today, as you can see on the screen as well, because I'm fancy with this new video technology, is to pack a heating pad. So recently on my travels, I've been packing a heating pad with me, which has been very comforting. I never know when I'm gonna get back pain or abdominal pain or any type of pain in my entire torso related to my kidneys. So packing a heating pad wherever I go has become a must-do for me. I also have a portable heating pad, so that I really suggest as well with like the heating pad thing, just because the portable one, I can like charge it and I don't need to have it plugged in somewhere. As long as it's charged, then I can just kind of wear it. If anybody's interested in that kind of stuff, I can be happy to share links of where I got this. But But yeah, so my travel tip of the day is pack a heating pad when you go places, because you never know when you'll need it. Even, I mean, for other conditions too, if you have chronic pain or whatever, heating pad is one of my lifesavers. So thank you guys so much for checking out this video today, and I hope you learned something interesting and fun, and I hope you're looking forward to coming back next week to learn more about my symptoms in depth a little bit. I'll show you a picture of my kidneys. I'll show you some pictures of what kidneys look like taken out. Like, they're pretty crazy. So thank you again. Please subscribe and share, and I'm still looking for kidneys. So if you know anybody that wants to share one, pass them along my way, and I will see you guys next week. Have a great night.